Hi, my name is Evelyn Deutscher and I'm a student at Lane Community College Dental Clinic, and I will be making a presentation about the dental hygiene process of care. So there are 5 steps to the dental hygiene process of care. It is assessment, diagnosis, planning, treatment, or implementation is the proper word, and evaluation. So we're going to go through each of the steps. Is assessments. In assessments, we kind of start to interview you. We talk and we dialogue. We get a sense of your medical history. If you have any systemic conditions like diabetes, high blood pressure, anxiety, depression, anything that can impact your overall systemic health and mental health, because that can have an effect on your oral health. We also get your dental history, so we see if you've gone to the dentist regularly, if you're in need of more treatment needs because you've been without care for longer, or if you're having any immediate problems that might take more precedence over certain other situations. So you wouldn't get a regular cleaning if you needed a root canal because you were having an abscess in a tooth at once. So after we finish our interview with you and get a kind of good aspect of your medical and dental histories, we will kind of begin your oral hygiene assessments. So first we'll often do an oral cancer screening. So we'll look at your thyroid gland, your lymph nodes, your TMJ joint, and your lymph nodes in the back of the neck, and see if there is any external manifestations of oral cancer or any illnesses that may be occurring that may not have shown deliberate symptoms that you are able to tell that need help. Then we will look inside the oral cavity for signs of oral cancer. So we'll look at we'll feel the floor of your mouth, we'll look for any tissue and color changes, we'll look along your tongue to see if there is any alterations there, and at your palate and see. After that, we begin the perio chart. So there we measure the gum pockets around your teeth and see how the supported apparatus that connects your teeth into your jawbones is going. Here is an explanation of why we would do periodontal assessments on you. So here you can see at the top there are a variety of measurements ranging from 1 to 9+ millimeters. In healthy tissue, the measurements will be 1 to 3 millimeters. In some cases, when there's inflammation and starting a breakdown of the periodontal structure, there will be 4 millimeters. 5 and above indicates that your periodontal condition has progressed and there is bone loss at that point. Very often will we see deeper pockets that don't occur with bone loss. So after that, as you can see down here in the next picture, you have a cross-section of your tooth as it is in your jawbone. So when we are taking the probe, we are measuring from the top of the gum tissue here down to where it attaches on the root of your tooth. So we'll slip a probe in here, as you can see in this photo down here, and see. So in cases where there's bone destruction, this peak crest of that bone will be degraded and will be flattened, and as a result, often the connective, instead of being here, will be here up along the root, and so our probe can go in farther. After we do those assessments, or before, often we start with x-rays. Here is an example of a full mouth set of x-rays. This would often be done every 5 years, or if you've gone without dental care for a long time. One of the main reasons we take such an expansive film set is to see all your teeth, the bones, and the roots. So in this case, we would be able to see if there was a periapical disturbance, such as an abscess and possible needing of root canal, that we may not be able to tell clinically. We'll also be able to see your bone level throughout. And it's not clear in these radiographs, as the distance is not close enough probably, but here in this case there has been slight bone loss. And you can see that because in between the teeth it's slightly fuzzier and the crest is not super defined and sharp right up against the crowns of the teeth. Now on average, if you are a regular dental patient, you'll be coming in and we'll take just these 4 sets of films right in here. These are what we call bite wing films. And here we take these films to see if you have any cavities, such in the case here, or if you're having any bone loss. So often these will provide warning signs for us. After we complete your periodontal charting and your radiographs, we will often undergo risk assessments. So where we establish your medical and dental history before, this is kind of a more critical eye at individual risk factors for certain conditions. So we'll look at your caries risk factor, and levels that can increase it is infrequent brushing, frequent consumption of sugars or carbs. We can also look at periodontal risk factor. So if you've already had periodontal disease, whether it is stabilized or not, you're at an increased susceptibility to having further progression of the periodontal disease. There's also kind of systemic factors, say if you have diabetes, again, because periodontal disease involves your immune system, you are more likely to have an increased risk of periodontal disease occurring or progressing if you had such condition. After all these assessments are done, we move on to the second stage, which is diagnosis. So I, the clinician, and the doctor's involvement often, will look at all the findings we have: the gingival inflammation, the periodontal pockets, the radiograph evidence of bone loss or not bone loss, caries, or periodontal periapical disturbances, and we'll come up with a diagnosis. In step 3 of the dental hygiene process of care, we begin planning. In the step 3 dental hygiene process of care, we work with you as the patient to establish a treatment plan that will meet your needs and wants for your teeth, such as having a wider smile, minimizing cavities, or seeking treatment because your gums bleed while you brush. And we will look at our findings and see what treatment options we have to best meet your needs and wants for your teeth, and what we establish as you needing for treatment. After phase 3, where we plan your treatment plan, we begin phase 4, which is the logical progression, where we implement that treatment plan. Here in this phase, we will either perform prophylaxis, periodontal maintenance, non-surgical periodontal therapy, depending on your periodontal condition. We would also do whitening treatments if that was what you aesthetically wanted, or we would implement restorative treatment needs if you had any caries that needed to be treated. It's important to note that in this phase, we will also work with you to establish a home routine. So here we will look at your brushing technique, how you brush, how often you might brush. We'll also look at how you clean in between your teeth, if you floss, the dreaded flossing, or if you use a toothpick or any other method to clean in between your teeth, and other habits that may be contributing or not contributing to the disease process occurring in your mouth. It is at this point that we will set goals to try and change your behaviors to more healthy ones, or continue encouraging behaviors that are already healthy. Lastly, we move on to step 5 of the dental hygiene process of care, which is evaluation. At this point, you've received all your care, whether restorative, periodontal, or any other treatment plans that have been offered at this point, and we'd see how the treatment worked. If you received whitening treatment, we would see your progression, and if you needed further treatment. Same thing for periodontal, or if you had cavities that still needed to be filled. At this phase, we see how far the treatment plan has gone so far. And seeing how effective it was, and if the treatment plan needs to be modified so we see the results that both you and us want as a team.